Welcome to the lung page. Today we are going to see another interesting chest X-ray challenge number 14. So this is a chest X-ray. History is 35-year-old female complained about constant back of the chest pain for 4 months duration. So when we took a chest X-ray, so this is the chest X-ray. So what do you think? What is your diagnosis and what is your differential diagnosis, or what is the clinical science? Okay, we'll see one by one. When you see our order, A, airways completely normal. B, bones you see all are normal. Cardiac contour normal. Diaphragms normal, no effusion. Right, when you see the lung field, here is lung field is normal, here also normal. But when you see this high area, right? So here this is a mass-like lesion is there, right? So we suspect there's a mass. And when you look very carefully, you see this trachea and right main bronchus is visible. And also you see here, this dot is the photography. This dot is there, these vessels are visible. So this is called hilum overlying sign. So what is the chest X-ray interpretation of this chest X-ray is means right-sided mass lesion with hilar overlying sign. So when you suspect this hilar overlying sign, so we have to think what are the causes of hilar overlying sign. So these are the causes of hilar overlying sign: anterior mediastinal mass, middle mediastinal mass, or posterior mediastinal tumors, hilar lymphadenopathy, pericardial effusion, vascular enlargement, cardiac enlargement. These are the causes for hilar overlying sign. So we have to know what is hilar overlying sign. Hilar overlying sign means the pulmonary vessels and pulmonary arteries and hilums clearly visible through these mass lesions. These are called hilar overlying sign. I think now you people are very clear. So we suspect what is this mass? Maybe anterior mass or middle mediastinal mass or posterior mediastinal mass. So with this suspicion, we took a lateral view. So you see the lateral view is very clearly indicate there's a posteriorly involved mass lesion. So what is the diagnosis for this chest X-ray? Posterior mediastinal mass, because this here is a high level line sign is there. So previously we look what are the differential diagnosis for this high level line sign mass lesions. So we suspect which it is anterior or posterior. So that's why we took a lateral view. In this lateral view, you see is clearly see the posterior mediastinal mass. So we have to think about what are the causes of posterior mediastinal masses. So these are the causes of posterior mediastinal masses. Posterior mediastinal masses, most common causes are neurogenically origin, right? Neurologically origin. So main causes are schwannoma, neurofibroma, ganglionoma, neuroblastoma. These are the causes of posterior mediastinal tumors. That's why this patient have a constant pain, back of the chest pain for several months. I think now you people are very clear about what are the causes of posterior mediastinal masses and what about hilar overlying sign, right? Stay tuned. We'll see the another interesting chest X-ray. Bye.